Hi, I'm Nicole, and I'm here to tell our student stories at Penn Foster. Today, we are meeting with a Veterinary Tech Career Diploma graduate, Savannah Reed. Hi, welcome.
Hi, thank you for having me.
Absolutely. So, we wanted to let you know that you are a graduate of the Year Finalist. We received your application and we were really impressed with your story and your results. And, we just thought you were so wonderful and we loved your outcomes. So you are a finalist. Congratulations.
Oh my.
How do you feel?
That feels amazing. I put in a lot of work and I just submitted it just to see what would happen. And I didn't really expect the email back.
Yeah, definitely. No, you are really, really well deserving. Did you have any idea when I first reached out by email that it might be about that?
No.
Really? Oh, wow. I was hoping I'd get to kind of surprise people, but I wasn't really sure, if it really would be a big surprise. But just for everybody, watching and listening, just a little bit of background. So as I said, you are a vet tech. You worked full-time at a vet hospital while completing your program, correct?
Yes.
And you finished in less than a year. And you also have your elite fearfree certification.
Yes, I do.
That's so great. So what were you doing before you started working with animals and what brought you into veterinary medicine?
So what I was doing before, I was working at a jewelry store in retail for about 3 years. Absolutely loved it. I was able to help out people with weddings, engagements, all the exciting parts of life, and sometimes not so exciting at the same time. But then, unfortunately, COVID happened and we were shut down for many months. And I was a little uncertain of would we ever open back up. I absolutely loved working with the people. So I did a lot of soul searching and I was like, you know what? I've always wanted to do something with animals, but didn't really know what I wanted to do. So my family and I were actually brainstorming and we're just like, hey, you know what? You can get the aspect of working with people and animals. Maybe you should look into this. So I got a job at a veterinary hospital that was willing to take a chance on me with no experience whatsoever. But I also wanted to learn a lot more than just restraint. So that's how I stumbled across Penn Foster.
So that's great. So in your application, you said, you learned as much as you could. You just said, you wanted to learn more. So what was it about Penn Foster and its program that kind of drew you in and appealed to you?
From the outside of it, when I was reading it, it sounded like, oh yeah, we're going to teach you more restraints. We're going to teach you medical terminology. How can you handle animals in different situations? It was just really in depth where I felt like this would be a good stepping stone to then eventually getting my associate's degree, my bachelor's, and then specializing.
Oh, that's so awesome. So you also, you completed your program in less than a year. That's it's really fast. And you were also working full time. You said sometimes 12-hour shifts. What was your day-to-day like? How did you manage to fit everything in without going totally crazy?
So basically, I think I was waking up at 4 a.m., doing a couple of hours of notes, studying, testing, and then I would do my 12-hour shift from 7 a.m. to 7 p.m., sometimes later, depending on the needs. And then I would come home and then do the same thing again, over and over and over again.
Wow. So that was definitely intense. How did you, so obviously you kind of had like a little schedule set up for yourself in terms of, morning, work, evening, probably straight to bed. How did you organize your coursework? Did you create to-do lists, checklists, anything like that? Did you set goals for yourself on, when you would finish a chapter or section and then, advance to the testing portion?
Yes, I did. I had my little agenda. I was making, this is what I want to do. This is what I have time for. And then I kind of had a goal of where I wanted to be. Like, do I want to have this test done by this week? I want to have this chapter done by this week. I wanted to try to stay on track and hold myself accountable.
Did you have an easy time with that at first? Because everything is self-paced. So sometimes it does take like an extra step of discipline? Was it easy? I mean, obviously you had, a set plan, you had set goals that you were going to accomplish, but was it easy at first? Were you just kind of like hit the ground running? This is what I'm doing. This is how I'm doing it. Or did it take a little while to adjust to that type of scheduling?
I think it took me about a month to figure out how Penn Foster worked. This was what was required of me, and this was what I had to take notes on. Once I figured that out, it was pretty easy to stay on track.
That's great. So did you ever feel, I know some people worry about an online school and having the resources available, because you're not in front of a professor in a classroom where, you can ask a question immediately if you don't understand something. But did you feel like you had support regardless of that fact?
Yes, absolutely. There were times where I did reach out to my teacher and they were pretty speedy on getting back to me.
Oh, that's great. How about any of the other resources, like the online student community or some of I know Vet Tech is really, really active. You're really active group of students in their Facebook groups and community groups. Did you ever use any of those, or do you still use them?
Yes, I believe I'm still in the Vet Tech Facebook group, and I go back and forth and constantly learn new things every day.
Oh, that's so great. So it's really, I'm always really impressed when I go in there and I look at it, like how helpful everyone is to one another and how active everybody is in staying in touch and answering everybody's questions. And it just seems like even though many people have already graduated or finished their programs, that they're still communicating and that kind of like base for learning is still in place, even though you're not technically in the class anymore.
Yes, they are a great group of people.
That's so great. So what were the best parts of your program? What did you like studying the most? What did you find the most interesting?
I would have to probably say the most helpful was the medical terminology, without a doubt, being able to decipher the doctor's notes from being on the other side of it. Also, I would have to say the anatomy, just trying to figure out, okay, this is connected to this bone. This is what happens when you're doing a blood draw. This is exactly the vein where it travels up the leg.
Oh, wow. That's really interesting. I have pets, but I definitely don't think about like it that in depth, when I'm taking them in for things. Obviously, it's not my job to do that, but it is really interesting hearing, just how much you guys have to do and how much you have to know in order to do all of that. It definitely doesn't seem like an easy job at all. I give you all the credit in the world. Your patients can't tell you, what's going on, or, any of that. So it's really interesting, the kind of coursework that you have to study and how well versed you need to be. Did you have to do an externship?
Yes, I did. I did I think it was 100-hour externship, and the place I work at was more than happy to help me out through that process.
Oh, that's great. I was going to ask, were you able to, do it where you already worked, or did you have to go elsewhere? Because a lot of people at the start of the program, you hear they get really nervous about the externship and how intense it's going to be or how difficult it's going to be, or just, how the placement works. So it was kind of already, did you have to do additional hours into what you were already working, or did they kind of incorporate that into your already established work day?
They were very flexible. They were able to fit what I needed to get done within the time I did work, and they went above and beyond several times for me.
Oh, that's so wonderful. How much of your coursework have you now been able to apply into your everyday routine?
I would have to say probably 80% of it.
Wow. That's a really big percentage. Sometimes, you go to school and you learn things and it just kind of sits at the back of your mind, and that knowledge is there if you ever need it, but you don't necessarily apply it. But 80%, that's a huge chunk.
Yes, the place I work at, they want their people to be able to practically do everything. If a doctor asks you, hey, can you do, for example, like an ear cytology to see what's going on with an ear infection, they would like you to do that. So they're very hands-on. They want their employees to have as much knowledge as possible.
That's wonderful. And I think, I mean, for me personally, as a pet parent, that makes me feel really good, knowing that whomever has my dog knows exactly what they're doing, and that, they're really, really well versed, and that, there's not going to be a waiting period if there's an emergency or something where it's like, well, hang on, we have to call somebody else in because I'm not capable of doing this, or I don't know how, or I don't know what it is. So, really love that. You also received your fearfree certification. Can you tell us a little bit about what that is and what the process is for earning it? I know that we have it kind of in our program, I guess, but I really don't know what it is myself. This was one of the first times. It's relatively new, and it's one of the first times I've come across somebody who has actually received this certification. So,
absolutely. So what fearfree is, they try to go and look at everything that you would possibly do in the vet office, restraint, even just getting the animal in a room, and really analyze it to see, why are these animals so scared when we come in the room? I mean, they see our work scrubs and they're like, oh no, what's going to happen? So they really go through the entire process, and you learn other avenues to kind of appear less scary. Just letting the dogs approach you, working slowly. As for restraint, not being so fast to just put the muzzle on, because the muzzle can be very scary. So it goes through all of that, and you learn valuable things on how to pretty much make it a less scary experience.
Oh my God. I really love that, because I have both of my dogs are rescues, and it's like the second we pull up to the vet's office, they know exactly where they're at, and they just have complete meltdowns, and they are just a ball of nerves, and they shake uncontrollably. And I always feel so terrible, because I know they're scared. I know that they're nervous, and I don't know how to get them to calm down and know it's going to be okay. I mean, they're obviously fine once they leave, but that fear is very, very real and intense for them, I'm sure. Have you noticed a big difference in, say, repeat patients from the time prior to earning that certification to afterwards, and how you interact with them and how they interact with you and respond?
Yes, there have been several cases where at the place I'm at, they'll have like a little alert on their chart. And the alert is just to say, hey, this dog may have the potential to bite, may be aggressive. And I think since being at my job, I have been able to change that dog that is fearful, aggressive, potentially biting, and making that into a good experience. And I can happily say that I have probably changed 20 alerts with different patients, where it's just finding that thing that they prefer, whether it's, we're just going to do some head taps, with restraint, less is more. Maybe they just want a butt scratch and some peanut butter. It's just kind of those little quirks that make them feel more relaxed, so you can get the job done, but yet they don't have to be scared.
Oh, that's so lovely. I love hearing that. That's so nice. Do they interact then differently? Is it more of an association with you as an individual, or do they then say they're with another tech? Do those behaviors come back when they're with somebody else? Or is it, I mean, obviously I'm sure you put like a note in the chart saying, like this dog likes this, or, like the peanut butter, the tap on the head. So does it, in that sense, I guess, help the other techs in that, say you're not working that shift and this animal comes in, do they still have those aggression or fear issues, or do they kind of know, okay, this is like a safe space now, or is it a toss up?
I think most of the time, once they keep having repeat good experience, then they won't be as aggressive. Most of the time, I don't think I've seen a case yet, but when I do say, hey, this dog likes peanut butter and butt scratches, someone else can do it and the dog is still fine.
Oh, that's really great. And I'm sure that the actual pet parents really appreciate that too, because it ends up getting very stressful on them, especially if they are aggressive in that, you're always afraid like, oh, what are they going to do? Are they going to injure somebody? So I'm sure that really kind of allays a lot of their fears as well. You also, so since you finished the program and you got your certification, you also received a raise. Do you think the Penn Foster program contributed to that? Do you feel like you have more confidence now in addition to like the academic knowledge you got?
Absolutely. I can bring more to the table and be able to properly educate clients, whereas before I didn't have that knowledge. So it greatly helped me.
So that's a really interesting point, I feel like, that you bring up, because, obviously we know what your work is in terms of working directly with the animals, but what is that like working with the actual human aspect of it? And how did the program help prepare you for that side of things?
I absolutely love working with the people. With the knowledge I gained from Penn Foster, I can go through an entire pre-invoice of what we're going to do at a visit and talk to them and say, hey, we're going to do this blood work because we need to check blood count. We have to do this one to check organ function. So it's just, I can educate the client. They will then understand, okay, this is what this means, instead of just saying, yeah, we're just going to do blood work. They have more of an understanding. And then with that, they are more willing to do more treatments to figure out what the diagnosis is for that animal.
Oh, that's great. So also, in addition to all of these responsibilities, you mentioned that you're also running the hospital social media. How did that come about? And did anything you learned at Penn Foster help prepare you for that?
So back when I was working at the jewelry store, I did do their social media and their advertising. And when I got to this hospital I'm at now, I kind of saw that their social media posts were few and far in between. So I reached out and I said, I have experience doing some social media, but I also, with my Penn Foster degree, I have a lot of animal knowledge that I feel like this hospital would benefit from. So I kind of took the social media and just hit the ground running.
Oh, that's so cool. So has that helped to improve engagement with, whether it's patients or patients' parents or, potential clients coming in?
Yes, I feel more people are stumbling upon our Facebook page, or their friends and family will tag them. And I feel like we have more clientele walking in now.
Oh, that's wonderful. So the practice is definitely it's growing thanks to you. So you also said that, this was a life-changing process and it helped you find purpose. When did you realize that, and what made you come to that realization?
I think I came to that realization my first day at the first animal hospital I was at. I did, like I said, a lot of soul searching when COVID happened and everything shut down, but I knew I was right in the fields that I belonged in on my first day.
Oh, that's so nice to hear. So what are your goals going forward professionally?
So right now I am currently finishing up my animal aromatherapy certificates, which is super exciting. I'm really interested in the integrative medicine. So that's how that drew me in. I'm currently in my associate's degree. So I plan on completing that, my bachelor's, and then eventually specializing in some sort of integrative medicine. I think I'll probably do Chinese traditional veterinary medicine and a couple other degrees.
Wow, that's amazing. And those are such like incredible goals. And I don't think I to be totally frank, I've never even heard of like incorporating traditional Chinese medicine into veterinary medicine. I think we always just think it's kind of like a straight traditional path in terms of Western medicine, what's common. What kind of got you interested in pursuing this kind of other direction that maybe people don't know as much about? And can you tell us a little bit about it?
Absolutely. So my eyes were open to this when I started working at this animal hospital I'm at right now. Two of the veterinarians I work with are both certified in acupuncture, and then one of them is certified in rehabilitation, traditional Chinese veterinary medicine. So once I started working there, they really opened my eyes to what else veterinary medicine could encompass. I always thought it was just, this is Western medicine, this is how we treat that. So with that, I wanted to start pursuing that avenue because one of my dogs, a little Chihuahua, has very bad anxiety. He's great in the house, but once he kind of steps out into the world, he's very anxious. So I brought him to one of the vets I work with, and over the month or two, he started different Chinese herbals, and then he also did a little bit of the chiropractic adjustments. I saw a huge change in him. So not only did I see a change in my own dog, I also saw changes in patients. We had one patient that couldn't walk. After a couple of sessions of acupuncture, he walks right out the door. So it really inspired me to pursue that.
I think I'm going to need to pay a visit there because I have a very old dog who has very bad arthritis, and she still tries really hard to have a lot of energy and jump on things, but sometimes she doesn't quite have the strength that she used to. She kind of misses, and you could tell she wants to be energetic and she wants to engage in that way, but her body just doesn't let her do it. So this is so cool to know that these are out there, because I've never, to be totally frank, ever heard of doing any of this with animals. So thank you for enlightening me. I really appreciate it.
You're welcome.
So are you doing your associates with Penn Foster, or did you go to a different school?
I'm going through Penn Foster. I liked how the entire plan was laid out.
Oh, that's great. So it's definitely like a continuation. Have you seen any overlap in what you did in the career diploma to now? Do you feel that the information you learned there has helped set you up better for the degree program?
Absolutely. I feel like the certificate program is a stepping stone into the associate's degree. I feel like if I did not take that, I would be very lost.
Do you feel like it helped you make that decision to continue on, or did you think you would do that anyway?
I already had the plan of eventually getting my associate's degree.
Oh, awesome. So obviously you had a great experience in that, you're continuing on and going even further with your education. So if you were talking to, say, somebody who's newly working in your animal hospital and kind of in a similar situation to you, and it is debating about going back to school and earning some sort of credential, whether, it's the certificate or an associate degree, what advice would you offer them, or, what would you tell them about Penn Foster that you feel is really important that they should know?
I would definitely suggest the Penn Foster program. I would tell them that it was easy to be able to maintain a full-time job and do schooling at the same time. When there were days where I had more of a workload at work or I was coming home later, I was able to adjust my schedule and be able to still achieve what I wanted to achieve.
Oh, that's so wonderful. Thank you so much for sharing your experience and your knowledge with us. We really appreciate it. Is there anything else you want to add or throw in there?
I would just say, if anybody is thinking about pursuing a veterinary technician degree, I would definitely suggest Penn Foster.
Thank you so much. I appreciate your time.
Thank you.